Welcome back to Houston Live. Dental implants can really change how you look, but more importantly, how you live. Board-certified periodontist Dr. Michelle Azar with the Texas Dental Implant Center is here with his patient, Xiomara Saenz Phillips, and her journey to restoration. You have such a beautiful smile. I don't want to put you on the spot and have you smile, but we have some before and after photos. The restoration happened, what, 6 months ago?
6 months ago.
And why, Xiomara, did you decide to take this step?
So really a health decision. I was not smiling for one, and two, the missing teeth made eating really difficult. So I had to make a choice.
So it was an aesthetics thing, but also a functionality thing. How long had you been struggling with missing teeth and the lack of ability to chew?
You know, you become to normalize and you don't really equate, but at least 10 years.
Okay, you look like a different person. These are Xiomara's before photos, and you were so beautiful.
Thank
Your
you.
teeth look quite different before. What was that like for you? You were saying that you didn't really smile. Did you find yourself avoiding social situations?
You avoid social situations. You smile with your mouth closed. You really don't want to be confronted by anyone who wants to have a conversation with you. But the work that I do, you're in front of people all the time.
Yeah.
So I had to do something for myself.
You look younger, Xiomara.
I will take that. Thank you.
Do you feel younger?
Of course. You know, you can smile, you can live your life. You feel like a whole different person.
Wow, look at that. By the way, what kind of work do you do that has you around people?
I work for the school district. I work with Fort Bend ISD.
Okay, so you're always dealing with people of all ages.
Yes.
Dr. Azar, Xiomara's case is not atypical, right, where people feel a little bit reserved, maybe they don't want to smile, lack of confidence, but also I feel like this is a great example of not just restoring the teeth, but the overall look of the face can be impacted.
Yeah, I think when she was doing the consult, because she has such a beautiful face and facial features and muscle tone, so I thought putting a nice smile will change everything. And then it was true. Like the moment we put the teeth in, and I immediately got my camera and told her, hey, we need to take a video of that.
Yeah,
Couldn't stop myself.
Because even you were so impressed with the results.
I was so impressed, and it just highlights how good, like when you have good structure of teeth and how it alters the muscle around it, the lip support, everything that we studied basically, but to put it in that perspective, it's amazing.
And talk a little bit more about that. I mean, when you're talking about the muscles in your face, the lip support, the overall look and feel of your face, the profile, right? I mean, people's look can be greatly impacted by a great smile or lack of a great smile.
Right, yeah. So part of the teeth, the part that we don't see with the implants is going in under the lips, and we have control on that with the sides and the profile, like you mentioned, and it just puts a lot of support underneath it. So it's like a natural filler, especially for people who have been missing teeth. These muscles tend to drop a little bit, and then that's like returning back to normal where they used to be.
So people might be dealing with something like a sunken in feeling or a sunken in look. The digital lab that we've talked about on Houston Life many times before, this allows people to see in great detail the before and after. And this is Xiomara's before. This is your actual mouth, Xiomara.
Sad.
Well, I mean...
Happy.
But now it's great. Dr. Azar did a great job.
And so talk to us, Dr. Azar, why is it so critical, this part of the process, to be able to show a patient what their teeth could look like, and also just the reality of their current situation?
So I think the biggest thing about the digital lab that we have is when we have the patient in the chair and we have the scans outside the mouth, it's like when we combine these pictures and the scans, we tell the patient go home, but we have some studying to do before we start the procedure. We need to determine where the position of the teeth, because we're dictating where the teeth need to be and how the bite is gonna align together with the upper and lower teeth. And that's a big part of what makes our process very unique, is we count in consideration the whole facial features, the bite as well.
To make sure that the teeth look like they are natural. Your teeth, totally natural. Do they feel like they're your teeth, Xiomara?
Yes, 100%.
Yeah, and that, I mean, this is an x-ray, by the way, of the posts that are in the mouth, in case people are curious to see the structural support, essentially, Dr. Azar, of the teeth. Is that right?
Right, yeah. So on the same day that we take the teeth out, we place in 4 to 6 implants in each jaw, and we give the same day temporary teeth. So that image here is the CT scan of the final teeth or implant positioning. All the studies got to be done before we start the process, and that's one of the cases that I'm very proud of with that final outcome.
This is really incredible, and I know you've had a lot of patients, Dr. Azar, come see you. Maybe they've had kind of like a nightmare dental scenario, and you have to go in and correct the work. But natural, it seems, is the new luxury, right? It's not about putting these giant, really fake-looking teeth in someone's mouth. We just saw a set of teeth. They look totally natural, and that's what you go for every single time.
Yeah, and I think because the teeth are meant to stay for a lifetime too, it's worth it. It's worth it to spend that time and do trial sets and make sure that you're going to be comfortable living with it for the rest of your life.
They're going to feel comfortable, look comfortable. What was your reaction the first time you saw your brand new smile, Xiomara?
I was amazed. I could not believe that that was me. Just the confidence that you feel. You're not scared to smile, or you have that confidence, right? That you look good. That it looks good and natural. Thank you. Thank you. Thank you. But Dr. Azar was great. His whole team just made this to be a seamless process.
Well, Dr. Michelle Azar, it's great to see you. Xiomara, it is so nice to meet you. If you see this woman out on the street, don't be surprised if she's smiling. Xiomara Saenz Phillips, thanks again for stopping by and sharing your story. Congratulations.
Thank you.
You look great.
Thank you. Thank you. Thank you. I appreciate that.
Very, very nice. Well, in the meantime, the Texas Dental Implant Center does have a special offer for Houston Life viewers. The first 20 callers will receive a complimentary consultation after a short pre-qualification call. That consultation includes a one-on-one chat with Dr. Azar, 3D scan, and x-rays as well. That is all a $1,000 value. If you'd like to schedule your appointment, you can call 346-1ARCH. That is 346-663-2724. You can also go online, bestdentalimplantshouston.com. And you can scan the QR code below if you'd like to see more incredible patient transformations. And we will be right back with more Houston Life.